I want to bring in Dr. Francis Collins. He's the director of the National Institutes of Health. Dr. Collins, thank you for being with us. Look, having a vaccine is terrific. It's not the same as distributing a vaccine. And what we have here is some complexity with some of the vaccines, including the Pfizer vaccine. Before we talk about distribution, I want to talk about a different issue. Polling that indicates there are a number of Americans who are worried about a vaccine. You and I have had this conversation before. I have said that before I take a vaccine, I'm going to check with you. But 42% of Americans recently polled by Gallup say they would not agree to be vaccinated for COVID. What do you make of that number, and how do we get it lower?
Well, I think that reflects that this has been a tumultuous time as this vaccine is being prepared, as people are concerned about whether it's being prepared in a way that's politically driven as opposed to scientifically, that maybe corners are being cut. Once again, Ali, I want to reassure anybody who's listening that this is being done in a fashion that is absolutely focused on safety and efficacy, plus nothing else. Politics have nothing to do with this. We have done this at exceptional speed by figuring out ways to deal with some of the downtime that normally takes 8 years to get a vaccine. And now here we are on the brink of having 2 of them probably approved in less than a year. But that has not sacrificed in any way the rigor that's been attached to assessing these, and large-scale trials involving 30,000 or more people being assessed scientifically with no political interference. What I'm hoping, Ali, is that when people see the evidence for the safety and efficacy, and that's going to be very publicly declared in the coming weeks when the FDA has their open meetings about this, they will be reassured that this is something that can be trusted and will be safe for them and their families and can save potentially hundreds of thousands of lives.
And I want people to understand, coming from you, the reason I said I'm going to ask you is because you come from a long line of medical work and scientific work. You were the head of the Human Genome Project, so you know of what you speak. So I believe you on that. So let's put the politics out of it for a moment, because I think you're right that was a big part of it. There's another part of it that troubles me as well, and that is the news on the Pfizer medication, the vaccine, the news on the Moderna vaccine, and the news of the AstraZeneca vaccine. Most of it has come from the companies, not peer-reviewed articles, not regulatory bodies. And we did find out there was a mistake with the AstraZeneca data that was presented. What happens is these companies declare whatever they declare. The stock goes up. We find out that some executives in the company sold some stock. And that also contributes to this idea that, am I getting my information about the efficacy and safety of these vaccines the way I should be getting them? In a normal world, we wouldn't be getting it through press release either.
And again, this is not a normal world, is it? And everybody's anxious to find out the information. But I want to again reassure people, when a company says we see 95% efficacy, they say that based upon the work of a group of independent scientists in what's called the Data and Safety Monitoring Board, the DSMB. They're the only people that look at the unblinded data to see whether the vaccine works. They see it before the company does. And then if they see something that looks like a good result, they tell the company, look what we've got here. And then the company gets, as you might imagine, excited because they want to succeed too. And they make a press release about it. But the actual observation does not come initially from them, but from this group of independent scientists who we actually know really well and trust completely. I know it maybe makes people a little uneasy, and the data does need to be published in a peer-reviewed journal, and it will be. That takes a few weeks. And right now, nobody wants to wait a few weeks to find out what's happening. So part of it is just the pressure to get the answer.
Dr. Collins, I always appreciate it. You're always reassuring to me. Dr. Francis Collins is the director of the National Institutes of Health. We appreciate your time this morning, as always.
Can I give you one more suggestion?
Rages on. Yeah, sure. Why not? I'll take all your suggestions.
Sure. We still need people to participate in clinical trials for vaccines. There are 4 more of them in the works, and for trials for people who are infected. There's a new website which is going to get put forward on Monday, but I'll tell you about it now. combatcovid.hhs.gov. It's one-stop shopping for people who are interested in taking part in trials and helping us get the answers.
combatcovid.hhs.gov. I tell you what, I will tweet this out, and I'll put your handle in the Twitter, and we'll send this out to people if they want to be involved in COVID trials. That was a really good thing to remind me of. Thank you for that, Dr. Collins, as always. Dr. Francis Collins is the director of the National Institutes of Health, and I will tweet out that website.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.